into our clinic. So I'd like to address the first question over here to Dr. Meenal. Dr. Meenal, when do you, maybe for a woman who steps into your clinic, has achieved menopause or is perimenopausal, when do you feel that she is deserving of MHT? And how do you explain, and in your mind, what are the short-term and long-term goals of treatment for this?
Thank you, Dr. Pia. And as you rightly said that, yes, it is the midpoint. The menopause is not the end. It is the middle point of your life, the movie called life. So it's the interval. So any woman walking in your clinic, and probably, yes, as Dr. Jyoti also mentioned and Dr. Arundhati also mentioned, that the history taking, probably we are missing out on what is menopause. Is the woman already entered the perimenopausal period? Probably we really get lost with, as Dr. Lavanya said, we get lost with diabetes, thyroid and other complaints with which the patient comes and walks in with the reports probably. So we are more focusing on the reports which are saying that the sugars are high or the thyroid is deranged or something. The important question that we need to ask the women is, what about her cycles? Is she already entered into the, as per the straw classification, maybe has she already entered into her -3 stage, or whether she is the perimenopausal period, or is she facing anything like hot flushes, or is she facing mood changes? So is she having a low libido? Is she having the vasomotor symptoms or the genitourinary symptoms? So probably we are looking at the symptoms, that if the woman is having a symptomatology of menopause or perimenopause. Because if she's a clear case of POI, that is the premature ovarian insufficiency, or if she's a clear case of early menopause, then we don't even think that whether we have to prescribe or not. Probably we don't even go for a detailed counseling and consultation or asking for a consent that do we prescribe you MHT. We actually prescribe already, and then we go for explaining that why we have written this prescription. But what is needed is at the point of transition, at the point of menopause transition, to discuss direct by leading questions that is the patient or is the woman or is the family, the quality of life, the changes in quality of life, is she facing all those challenges in terms of low libido, depression, or vasomotor symptoms, the hot flushes, vaginal atrophy, vaginal itching, or is she having loss of interest in the sexual life? So any woman with symptoms, symptomatology, I would always counsel the patient that there is still a long life to live. This is not the end, and we can treat, we can manage, we can bring life back to you. So that is what MHT means to a menopausal woman. And when we talk of goals, yes, of course, as I talked, we are treating symptoms. We are treating it, the menopause, or rather we are treating symptoms of menopause. So definitely the short-term goals are to alleviate all the symptoms. And when we talk of alleviating the symptoms, definitely begins with, again, alleviation of vasomotor symptoms, alleviation of the genitourinary symptoms, improving the QALY, that is the quality of life years, and improving, just doing away with depression, making her more cheerful, bringing her back to life. So these are short-term goals. But a concrete long-term goal, what we are actually targeting, probably the biggest in the Indian scenario and the Indian women setup, is probably we are targeting prevention of osteoporosis. And also we are targeting prevention of the coronary artery diseases, or the vascular thrombotic diseases, or not allowing the carotid intermedia thickness to worsen maybe. So we are trying to prevent, on one hand, the vascular diseases, the vascular thrombotic diseases, and also we are trying on the long term to prevent osteoporosis, the osteoporotic fragility, fractures in the long run, and of course building up on the muscle strength, that is avoiding or preventing sarcopenia in our Indian women. So these are our long-term goals: the building on the musculoskeletal system, building up and preventing the cardiovascular diseases, and the short term are of course to improve the symptoms.
Right, absolutely. I guess, and sarcopenia is something that we don't really often talk about over here also. Let me